3 people are dead. 18 Americans are in federal quarantine right now at the University of Nebraska Medical Center, being monitored for a virus with a 38% fatality rate. The CDC just classified this as a Level 3 emergency response, the same classification they use for Ebola outbreaks. And the place it happened was not a barn, not a cabin in the woods, not a rural property with rodent droppings in the walls. A cruise ship in the Atlantic Ocean, April 2026. If you or anyone you love has been on a cruise in the last 6 weeks, what I am about to tell you in the next 10 minutes is not optional viewing. It is the information that determines what you do tomorrow morning. The virus is called Andes Hantavirus, and before this month, most Americans had never heard of it because it was supposed to stay in South America. The MV Hondius, a Dutch cruise ship carrying passengers from 23 countries, departed Ushuaia, Argentina on April 1, 2026. By April 6th, the first passenger was already sick. By April 28th, the last exposure had occurred. By May 2nd, the World Health Organization was officially notified of a cluster of deaths aboard a ship that had already been crossing the ocean for a month. Here is the number that changes everything for adults over 60. The WHO Director General said publicly, in a CNN interview, that he expects more cases to emerge, because the incubation period for this virus is up to 42 days. Which means passengers who felt completely fine when they disembarked, who hugged their families, had dinner with their children, went back to their normal lives, may still be inside that window right now. You are watching this video. That means you are still inside the window to act. There are 4 specific reasons why this 2026 cruise ship outbreak represents a different kind of threat than the hantavirus most people have heard about. 4 mechanisms that make Andes virus uniquely dangerous for adults over 60. And 4 things you need to understand before you, or anyone you love, boards a cruise ship again. Reason 3 is the one that explains how a man at a birthday party infected someone who simply said hello to him on the way to the restroom. And reason 4 is the one your doctor has almost certainly never discussed with you. We will go through all 4, but I am not starting with the obvious one. I am starting with what makes Andes virus fundamentally different from every other hantavirus strain that has existed for the past 30 years. And reason 4 is the one that connects the immune system decline that begins at age 60 to the 20 to 40% fatality rate that makes this virus unlike almost anything else in circulation right now. Mechanism: W1, person-to-person transmission. The rule changed. Everything you have ever been told about hantavirus protection assumed one thing: stay away from rodents and rodent droppings. Do not clean old barns without an N95. Do not sweep mouse droppings in your garage. Avoid closed spaces with evidence of infestation. When was the last time you were in close contact with someone on a cruise ship, in a dining room, in a shared corridor? That proximity is now part of the transmission equation. Andes virus is the only hantavirus on Earth confirmed to spread directly from person to person. Every other strain, including the Sin Nombre virus, responsible for North American cases in barns and cabins, only transmits from rodent to human. Andes virus transmits rodent to human and then human to human. The routes documented by the CDC and ECDC include direct physical contact, prolonged time in close or enclosed spaces, and exposure to an infected person's respiratory secretions or body fluids. The WHO has noted that airborne transmission is considered a possibility, meaning the mechanism of spread may be even simpler than close contact. In 2018, during an Andes virus outbreak in Ebola, Argentina, a man attended a birthday party. He sat at a different table from the infected index case. He interacted briefly with that person while walking to the restroom. He contracted Andes virus. That outbreak eventually killed 11 people. A single social interaction at a party produced a chain of transmission that crossed households. That is not the hantavirus of old barns and deer mice. That is something categorically different. If you have been on a cruise ship in the past 6 weeks, particularly any route that passed through South American ports including Argentina, Chile, or their surrounding waters, you need to call your primary care physician today, not to panic, to inform. Tell them you have potential Andes virus exposure and ask specifically about the 42-day monitoring window. The CDC has issued guidance for clinicians, Your doctor needs to know to look for it. That is Mechanism 1. The transmission rule changed. Mechanism 2 is about what happens during the 42 days when you feel completely fine. You came home from the trip, you felt fine. A little tired, but that is always true after long travel. You hugged your spouse. You had dinner with your adult children. You attended your weekly card game. You went to your doctor for a routine appointment and mentioned nothing unusual. If you were exposed to Andes virus 4 weeks ago and are only now developing symptoms, how many people have you been in close contact with since your return? The incubation period for Andes Hantavirus is 4 to 42 days. That is not a narrow window. That is 6 weeks of normal life during which the virus is replicating silently inside the endothelial cells lining your blood vessels. The WHO Director General confirmed publicly during this outbreak that the long incubation period means more cases are expected to emerge weeks after passengers have disembarked and returned to their home countries. ECDC published guidance specifically noting that the identification of additional cases after former passengers returned home is expected because of the long incubation period and the possibility that some infections occurred late in the voyage. The ship left Argentina on April 1, 2026. Cases had onset dates ranging from April 6 to April 28. Some passengers disembarked before anyone realized hantavirus was aboard. Those passengers are now quarantining at home across 5 U.S. states. The CDC's guidance for people with potential exposure specifies a 42-day monitoring period. During this window, take your temperature daily, monitor for fever above 101 degrees Fahrenheit, watch for muscle aches particularly in the thighs and back, and report any shortness of breath immediately, not in a few days. Immediately. The transition from prodromal symptoms to cardiopulmonary crisis in Andes virus infection can happen within 24 to 48 hours. 2 mechanisms, both invisible while operating. Mechanism 3 is the one that operates in the emergency room, and it is where most seniors lose the window for survival. You arrive at the emergency room. Fever of 102, muscle aches. You feel like you have the flu. The triage nurse documents influenza-like illness. The attending physician orders a chest X-ray and basic blood work. They send you home with instructions to rest, stay hydrated, take ibuprofen. 24 hours later, your breathing becomes labored. You return to the ER. This time, you cannot complete a sentence without stopping for air. Your oxygen saturation is 88%. You are intubated within the hour. How many emergency room physicians in your city have ever seen a confirmed case of Andes hantavirus? For most hospitals in America, the answer is 0. Hantavirus pulmonary syndrome is not on the standard differential diagnosis list in most American emergency rooms. Before May 2026, clinicians might have thought of it for someone presenting with a history of rodent exposure in an endemic region. They would not have thought of it for a 71-year-old who just came home from a cruise. This is precisely why the CDC issued a Health Alert Network advisory. The HAN system exists to push urgent clinical information to physicians when a new or emerging threat requires immediate awareness. The advisory explicitly warned clinicians to be aware of the potential for imported cases from the MV Hantavirus outbreak. It told hospitals to test for hantavirus, including Andes virus, in patients with compatible symptoms and potential exposure. But here is what that advisory cannot guarantee. It cannot guarantee that the ER physician covering a Saturday night shift in a hospital that has never seen a hantavirus case will connect your respiratory deterioration to a cruise ship you were on 5 weeks ago. You are the only person in that room who can make that connection. And you can only make it if you know to make it. If you develop fever, muscle aches, and any respiratory symptoms after recent cruise travel, especially travel that included South American ports, you must say these 4 words loudly and clearly when you arrive at the emergency room. I may have hantavirus. Do not wait to be asked about travel history. Do not assume the physician will connect the dots. State it immediately. The CDC advisory gives clinicians a direct pathway to test and respond, but only if they know to look. 3 mechanisms, all operating against you before you walk through the ER door. Mechanism 4 is the biological reason why adults over 60 face a fundamentally different prognosis from the same virus in a 35-year-old. 2 passengers on the same ship, same dinner table, same exposure. One is 34 years old, one is 71 years old. The 34-year-old develops fever and muscle aches for 5 days and recovers at home. The 71-year-old develops the same initial symptoms and is on a ventilator within 72 hours. The CDC noted that in this outbreak, older people and those with medical comorbidities are at highest risk for severe outcomes. What specifically makes age 60 plus so much more dangerous with this virus? Hantavirus pulmonary syndrome kills through a specific mechanism. The virus infects endothelial cells lining the blood vessels of the lungs. As those cells die and become leaky, fluid floods the alveoli, the tiny air sacs where oxygen exchange happens. The lungs fill, breathing fails. The body's capacity to fight this process depends on two critical systems. First, innate immunity, the rapid response inflammatory system that attacks the virus before the adaptive immune system mobilizes. After age 60, innate immune response fires at significantly reduced efficiency. Second, pulmonary reserve, the extra breathing capacity that kicks in when the lungs come under stress. Research shows that by age 75, pulmonary reserve is reduced by approximately 35%. What this means in practice: a younger immune system detects the viral threat earlier, mounts a more rapid and coordinated response, and has more pulmonary capacity to sustain oxygenation while fighting the infection. An older immune system detects the threat later, responds more slowly, and has less reserve capacity to survive the fluid accumulation that follows. The virus does not change. The body's ability to survive it does. You cannot reverse immune senescence, but you can use it to recalibrate your response threshold. Because your immune system will detect this virus later than a younger person's, your symptoms will feel milder than they actually are, for longer. The mild shortness of breath you dismiss as post-travel fatigue may already represent significant pulmonary compromise. Act on symptoms earlier than you think necessary. Call earlier. Go to the ER earlier. The window between mild symptoms and ventilator in Andy's hantavirus is measured in hours. 4 mechanisms, all of them active in the 2026 outbreak. All of them operating against the exact demographic that books the most cruise travel in America. And here is the finding that changes how you understand what just happened on the MV Hondius. The cabin in the woods was never the only danger. You just didn't know the danger had moved. For 3 decades, hantavirus education in the United States focused on one message: avoid rodent droppings in enclosed spaces, N95 respirators in old buildings, wet cleaning protocol in barns. The message worked for sin nombre virus. It was the right message for the right threat. But Andy's virus does not need a mouse. It needs proximity. It needs a crowded dining room, a shared corridor, a handshake at a birthday party. And it found exactly those conditions on a cruise ship carrying passengers from 23 countries across the South Atlantic in April 2026. The vacation you plan to celebrate your retirement. The bucket list trip you saved for. The ship you chose because it was small and intimate and felt safe. That environment, for a virus that spreads through sustained close contact, is the highest risk environment on Earth. This is not a reason to never travel again. It is a reason to travel informed. To know what you are monitoring for when you return. To know exactly what to say and when to say it if your body begins to signal something wrong. The WHO Director General said publicly, the incubation period is 6 to 8 weeks. He expects more cases. They will emerge in home countries, weeks after passengers have resumed their normal lives. The ship was the exposure. Home is where the disease will appear. Here is what the research and the current outbreak data give you. Not a reason to be afraid. A protocol. Because the 4 mechanisms that make this virus dangerous to seniors are also the 4 mechanisms you can act on right now. Person-to-person transmission is real, so proximity on future travel matters. Know it. Plan for it. The 42-day silent window is real, so if you have traveled recently, monitor your temperature daily. Today, starting now. Clinical invisibility is real, so you carry the 4 words that can save your life the moment you walk into an emergency room. I may have hantavirus. Immune senescence is real, so you set your response threshold earlier than your symptoms tell you to. Earlier than you think necessary, because for your immune system, Mild may already mean urgent. There is no vaccine for hantavirus. There is no antiviral medication. Treatment is entirely supportive. Oxygen, mechanical ventilation, intensive care, and time. Which means the only leverage you have is the speed of your response. The patients in the Nebraska quarantine unit who are being monitored, the ones whose outcomes are most likely to be good, are the ones who were identified early, who communicated their exposure history, and who received intensive care before their lungs reached the point of no return. That window, between the first symptom and the point of no return, is the only window that matters. And it is yours to use or lose. The person at that dinner table in April did not know they were carrying a virus. You were not meant to know either. Now you do. Hantavirus used to mean old barns and deer mice. In May 2026, the CDC issued a Level 3 emergency response about a hantavirus outbreak on a cruise ship. The WHO expects more cases to emerge over the next 6 weeks. And the Americans being monitored at the Nebraska quarantine unit are there precisely because nobody told them this was possible. You have been told. That is not a small thing. Leave a comment right now. Have you been on a cruise in the past 6 weeks? And which of the 4 mechanisms surprised you most? Because your answer shapes what I cover next week. Because the next video documents the exact clinical protocol the CDC gave physicians for identifying hantavirus in returning travelers, what they look for, what tests confirm the diagnosis, and the single piece of information that determines whether you are transferred to a biocontainment facility or monitored at home.